Welcome back to another episode of Working Girls Don't Gatekeep. Today we have Kelci Hunter with us. She is an aesthetic nurse practitioner out of Phoenix. I'm excited to get to know her. I wish that I lived close to her so that I could go and see her often at her clinic, but looking forward to connecting today. So thanks for joining, Kelci.
Thank you for having me.
Yeah, so before we get started, what does aesthetic nurse practitioner do? Kind of really high level. We don't have to get into it yet.
Yeah, so an aesthetic nurse practitioner, I received my family nurse practitioner license, and then I just basically specialize in aesthetic medicine. So it is still medicine, although people think it's just beauty, but it is still medicine. We still very much need to know anatomy and a lot of the pathophysiology and all of that about what we're doing. I mostly focus on injectables. So I do a lot of neurotoxin, dermal fillers, biostimulators, which are collagen stimulators. We have other treatments within our office, but that is mostly what I focus on. And then we are also a medical weight loss clinic as well. And so we have also transitioned into doing some of semaglutide. So I do a little bit of both of those things between weight loss and facial aesthetics.
Okay, those are all hot topics right now. So
Yes.
looking forward to learning more about that. All right, well, let's rewind a little. Think back to when you were in high school or in college. What was a fun job that you had? Maybe like one of your first jobs that stood out.
Yeah, so I don't know that I ever had anything that I felt like was super fun. I wanted to be a nurse since I was probably 7 years old. So I very much just jumped right into the hospital and working in the medical field. So I did work for my dad in high school. And so he owned a hearing aid business. And I put away files and clean the office and help answer phones and some of that stuff. It wasn't, I wouldn't have considered it super fun, but it was definitely taught me a lot of great things. And then my first job was actually as a patient care tech in a hospital in a cardiac ICU unit. So that was just a lot of grunt work. And so I was definitely glad to get past that. But yeah, I just didn't really ever do any like super fun job. I just jumped straight into medical field. So I was, I guess, too focused on building my resume.
Which is not a bad thing.
Yeah.
Yeah. Okay, it's sort of interesting that your dad owned a hearing aid business because that
Mhm.
kind of gave you an initial exposure kind of to the medical industry, I bet.
Yeah. Yeah. And he had owned that since I was one or two. And so I just grew up in that. I grew up in, um, customer service, and there was an aspect of medicine there. But there was also an aspect of entrepreneurship there. And so, yeah, it just very much all finally blended together over the last couple of years. So they actually are owners. My parents are actually the owners of our practice. And so now we all get to work together, which was not a thought in my mind back then. I just thought I'm going to go to nursing school and I'm going to be a nurse and I'm working in the hospital and I'm never working small business. I'm never working for my parents. And here I am.
Look at how that comes together.
Yes, right.
Well, I think it's interesting that you knew you wanted to be a nurse from such a young age. Tell me about your how did you get to being a nurse? Did you go to a 4-year school? Does it take a 2-year school, a master's degree? What does that take?
Yeah, so I chose to go the bachelor's route. So you can go and get an associate's in nursing and still practice as an RN. Some hospitals are phasing that out, and so they want all of their nurses to have at least a bachelor's and above. So I went ahead and I went to Millikan University, which is a small private liberal arts school in my hometown of Decatur, Illinois. And but it was known to have a really great nursing program. And so I, lived at home my first couple years and all of that, but it was a great nursing program. And so I chose to go that route because I knew I also wanted to go beyond that. Originally, I really thought I wanted to be a CRNA, which is a nurse anesthetist, so helps with the anesthesiologist in surgeries. Then after working for a little while, I decided, nah, I think that's a little too much for me. I'll go the nurse practitioner route. So I did go back and get my master's after working a couple years. I think I worked 5 years in cardiac ICU and ended up getting my nurse practitioner license. And so there's all sorts of routes, I feel like, to becoming a nurse and an RN, and whether you're an LPN, which is not as much schooling, or an RN, which is a little more schooling usually, nurse practitioner, it's just, there's all kinds of routes to get there. And so, but for me, it just made most sense to jump straight to bachelor's since I knew I wanted to go further.
Yeah. So do they in school tell you about the different directions, or how do you even learn about the differences between, I think you said LPN or RN, all these different letters? Do they teach you that in general nursing school?
Not really. No, I think that if
Great.
you're going to nursing school, most people know the difference between an RN and an LPN. So LPNs tend to solely pass medications for the most part. Registered nurse is kind of a step above that and creating like care plans for their patients. So they don't really tell you the difference though, I don't feel like. I feel like in nursing school you do get some clinical rotations that you do get to kind of see different specialties. And so that's kind of your opportunity to say, oh, okay, I think I would like this, or I don't think I would like this. But you don't get the opportunity to see every possibility out there. So a lot of it's some trial and error, but I think that, it's a world of possibilities in the medical field. So it lends itself to a lot of opportunities.
Yeah. Cool. Okay. So tell me then, you spent some time not as a nurse, not as an aesthetic nurse practitioner. How did you end up becoming an aesthetic nurse practitioner?
Yeah, so I ended up kind of falling into this field. This was not ever on my radar at all. I really thought, I grew up, cardiac ICU was like my thing. From patient care tech to during nursing school, I still worked a couple days a week during nursing school on the same unit. I developed friends and family there. And so I worked on cardiac ICU for 5 years. And my husband and I got married, and he actually was leaving his job and going back to physician assistant school. And so we ended up having to move. We moved from Illinois to Knoxville, Tennessee for him to go to school. And I worked at a federally qualified health center there in East Tennessee, in Madisonville, Tennessee. And it was definitely a totally different clientele than I deal with now. It was a very poor clientele, a lot of public aid patients. We had to do a lot of hand holding. It was people with a lot of not a lot of great access to healthcare. And so I jumped into that, and I did that for a couple years, and I did not love it. It was not my cup of tea. I didn't quite fit in there. I was kind of a northerner working in the South. And so that had its little quirks. So I ended up staying home for a little while after we had our daughter, and I actually did some marketing for my dad. So I kind of went backwards, I guess. And I decided, okay, I just need to take some time to figure out what I want to do. I did some marketing for him, and actually that proved to be super helpful later on as we kind of grew a different business. But So all that to say, we ended up moving back to Illinois after my husband graduated school, which was where all of our family was at the time. And we only lived there for about a year. My dad said, "Hey, I'm going to sell all of my businesses here. Anyone want to move to Arizona full time with us?" They had a house here already. And we were like, "Okay, sign us up." Um, for us, it was a little bit like, okay, we're both in the medical field. We can surely find something out there. My mom actually is an esthetician, and so she had a spa, more of a just a skincare spa in our hometown in Illinois. So she's like, well, what are we going to do out there? My parents are still young. They weren't ready to fully retire. And so they went on the hunt for some businesses and found Vita Bella, which was an existing med spa already. And so decided to purchase that. And the owner was the Injector. And so it was kind of like, hey, if they're going to phase out and sell it and she's going to leave, then we're going to be left with a spot for an Injector. So I had never, at that time, I was, how old was I? Late 20s, early 30s. And I thought, well, I don't know. I've never had anything. I've never had anything done. I've never had injectables. I used medical grade skincare and did microneedling and some stuff like that because of my mom, but never did I ever have filler or Botox or any of that. And so, but my mom's like, we're going to have this position. Like, do you want to go learn to inject? And I'm like, okay, sure. I'll try it.
You might as
So
well,
yeah, so I
given
thought,
that
might as
circumstance.
well. And honestly, it was one of those things where I was like, what am I going to do where I have enough time to still be a mom and be with my kids enough and raise them enough when my husband works in orthopedic surgery. So he works in a super busy field with hours that are, not normal. And so between potential on call and surgery hours, all of that, I was like, I need something that's going to be a little flexible with my schedule. And so, of course, nothing's more flexible than working for your parents, really. And so I took my injectable training certification course in Chicago before we moved. And just jumped right in once we got here. And the other injector was still working a little bit alongside me for a few months, but it was a lot of faking it till I made it. For sure.
Learning by fire.
Yes, yes.
Yeah. So, okay, a lot of interesting points. Just curious, what year did you move to Arizona?
We moved in 2019.
Wow, right before everything happened.
Yes. And let's see, I was 6 months pregnant with my second at the time. And yeah, we had no idea what was to come
Yeah,
next year.
no kidding. Well, it's almost good that you're out of Illinois at that point. So,
Yeah. Yeah. Less lockdown. We were
yeah,
the Wild West out here. No one cared that much.
and you get to be outside. So,
Yes. Yeah. The weather was at least good. True.
Mhm. Okay, this is a really cool story, how it kind of just fit into things. Interesting that your parents were on the hunt to find a business to buy, and your mom was already in aesthetics. So I'm
Yeah.
sure you were comfortable working with clients that way. She was as well. And then she needed somebody who was a nurse already. Because
Right.
is it true you have to be like a certified nurse, and at what level do you have to be in
You
order
have
to
to.
be?
So a lot of it depends on state by state.
Mm,
So I think you're in Florida, right?
yep.
Okay, so in Florida, nurses can't inject there. You have to be a mid-level or above. So you have to be a nurse practitioner, PA, MD.
Mm.
In Arizona, you have to be an RN. Most places are okay with RNs. Some let them be LPNs. In Texas, you literally have to have no license. You can just inject. You don't have to have any medical license. So it's very dependent on state by state rules and laws. So yeah, but most states it is RN. Yeah, and then for me, it made most sense because I had my NP. So you have to have a medical director here. So we are an independent practice state here in Arizona. So nurse practitioners can practice by themselves without being under an MD. And so because of that, I am medical director over Vita Bella, but I've also kind of created a side business where I'm actually medical director over probably 15 to 16 other estheticians and nurse injectors. So
Kind of like a consultant for them?
yeah, so they actually have to have a medical director overseeing them. So in order to even order product, order Botox, order filler, order medical grade skincare, they have to have a license to use. And so they essentially pay me to oversee them, use my license, order product under my name, all of that stuff.
Okay.
Yeah.
Okay, tell me about your day to day and what is it like to be an injector?
So it's actually super fun. It's one of the most, I wouldn't say it's super laid back. I mean, it's definitely still, it can still have its, tough days, but going from clinic to where you are tied down by, you only have 15 minutes with this patient. You only have 30 minutes with this patient. We're going to shove all these patients on your schedule so you can see as many patients as you can in a day, because that's how we make money for insurance purposes. It's just a totally different feel. It's very freeing, really. I can set the amount of time that I truly need with my patients. I never feel rushed for the most part, unless I'm running behind, but I never really feel rushed. I have plenty of time to chit chat and talk. And I love getting to know my patients more on a more personal level and, creating those relationships of, how's your family? How's your daughter? How was your trip? What are you doing for the holidays? All of those things. And I never got to have those types of relationships in traditional medicine. Time just didn't allow. And so this is just a much more fun and carefree side of the medical world. It still can be serious. It still can have complications, and there still can be issues, but it's a much more fun and carefree side of medicine than the everyday family practice and all that.
Yeah. So what are the risks in getting into injections? If someone is listening right now that is just a normal nurse in the hospitals and they want to transition, all of this sounds really great. What are some big risks that should be considered?
Yeah, so I think one of the biggest risks with injectables is I think people don't still understand that this is medicine. These are prescription medications. And so these are not just, we're slapping on some oil of Olay skincare, or, these are prescription medications that have gone through FDA approval and require a medical license to inject. So I think that people see the beauty industry and see this aesthetics industry and think like, oh, well, it's just Botox. Like, it's so easy. It's so easy to do Botox. That can't be that hard. And really, I think that I probably was guilty of some of that as a new injector, the more you know. But I think that you will find that the longer the person has been injecting, the more they realize that it's not just Botox. And honestly, Botox is probably the hardest thing to inject. I feel like it's harder than filler. Everyone's muscles are different. And so dosing muscles, anatomy, just all of that makes it difficult. So you can have complications with Botox. You can have droopy eyes. You can have, ptosis where the lid drops. You can have all kinds of complications. With filler, there are also even more complications that can happen. So sorry, hold on. Let me fix this really quick. So with filler, you can actually, it's a gel, right? So, gosh, I cannot, sorry, trying to fix this.
Okay.
Okay, so filler's a gel. And so it can actually, if we're injecting it, there are a few precautions that we usually take in order to not inject it into an artery. So your face is filled with blood vessels and arteries, but I think that some people just think, no big deal, we're just going to put filler in there and it's super easy. But we have all these blood vessels and all these arteries there that actually, if we accidentally inject this gel or this filler into an artery, we can actually block blood flow. And so if we block blood flow, depending on where it's at in which artery, it's basically a big feedback system. So they all kind of, attach eventually. And so it can cause necrosis of tissue, which, because you're not getting blood flow to that tissue, it can cause tissue death. It can cause blindness. It can cause because that blindness, if you're not getting blood flow to the back of your eyes, then it can cause blindness. So that's what we call a vascular occlusion, which means we're blocking blood flow. There are ways that we we aspirate usually to make sure that we're not in a blood vessel. It's not always foolproof. So it is a very risky treatment. There can definitely be some really big complications in these procedures that I think the layperson doesn't know about. And, most of them don't if you haven't ever had it done. And sometimes if people have had it done, they still don't know that these complications can occur because maybe no one's ever talked to them about it or explained it to them, which they should, but maybe it hasn't. I'm sure they haven't read their consent that they've signed that states that, but it is in there usually. So this vascular occlusion can happen. That's a pretty big deal. There is an enzyme called hyaluronidase that we can actually use to dissolve filler. So most filler is dissolvable, not all of them, but most of them, especially here in the US, are dissolvable. So if we catch these vascular occlusions early enough on, then we can reverse them. And usually there's no issue. There's no skin damage. There's nothing. But that's a tricky part, if you're going to someone who is unlicensed, who doesn't have good anatomical knowledge, who doesn't know where the arteries and vessels are, or in Texas, like if
I was gonna say
don't have a
that.
medical license and they're just doing it thinking it's just all fun and games. And that's not the truth. But I think that people just think it's a fun thing to do in the beauty industry. And it's not all that. It is truly medicine. You still are practicing medicine. You still have to know a lot of, anatomy and rheology and how the filler works and which one and where do you place it and depth and all of these things that no one thinks about. They just think it's fun and it looks pretty. So that was probably a long-winded version of what they need to look for. But all that to say, I really do feel like they need to really look for someone to train them that does have the experience and the knowledge. That is a trainer that has trained, a lot of other injectors. I trained for Galderma nationally, they're the makers of Restylane and Dysport. I train other injectors privately, just one-on-one or small groups. And then this year I did launch my beginner certification course. So that is what you're looking for. You're looking for a beginner course where they're going to teach you the fundamentals and the basics from the beginning. How do you mix Botox? How do you draw it up? What do you draw it up to? How are you dosing them? What product are you going to use where? So you really do need a good fundamental beginner injectable course. Unfortunately, there isn't a true certification course. There's not.
That's surprising.
Yeah, there's not. So there's no like medical institute that has created, a course or a test or anything like that to kind of certify you in aesthetics. I'm sure we'll get there someday, but it just hasn't happened yet. And so, the biggest thing that you can take away is just to really seek out someone that you really feel like has good qualifications and certifications and has been doing this for, a good amount of time, not just your friend down the street who has injected a couple people and said they can also tell you how to do it.
And if you're in Texas, like I
Please
would,
don't.
yeah,
No,
seriously,
there are some great injectors in Texas. I do just kind of feel bad because they are fighting against people who,
yeah,
and with that comes more complications. And honestly, when people have a complication, then they're going to reach out and find the people who are licensed to perform and inject. And so then that just leads to them having to reverse everyone else's complications. But, I don't know. Someday, hopefully, legislature catches
takes
up.
this seriously, yeah.
And hopefully someday there's a national certification or national level of rules, I guess, or laws, and not just a state by state basis. It would make it a lot easier for everyone, because this field is growing rapidly. So yeah, it's a tricky one.
Yeah. So another piece of this, and you mentioned this earlier, is the whole entrepreneurship side of this. So your parents technically own the salon. Is that what it's called? Spa. Yeah.
Yeah.
But it sounds like you're kind of like doing a lot of the main day-to-day things in terms of working with patients for this type of thing. How do you guys get clients? And because that's a huge part of this is not only what you're doing, but marketing yourselves and setting yourself apart.
Yeah, so a lot of it has been social media. It's actually a really great area and place to market. Um, you're a little bit restricted because there's certain things that you can't market, because they're prescription medications. And so Instagram, Facebook, they put the X on marketing prescription drugs on there. Um,
So you
so
can't say I do Botox because
yeah,
Botox is a brand name.
yeah, so it's tricky. Like if I'm trying to like boost a post or like do kind of some paid ads or something on Instagram, which also leads back to Facebook, obviously, they are really tricky. Like if I'm trying to boost or talk about semaglutide, which is obviously generic Ozempic, like nope, they won't allow it. If it talks about injectables or filler or Botox, says any of that in there, then usually they won't allow that either. So you have to be super vague about
Yeah.
marketing. But I think people just like marketing yourself is really what you're doing. You're marketing yourself as a person, and then eventually they find you and they find out what you do. But it's slow going, it's slow growing. I started from like nothing. But I do feel like that's the cheapest way to market. We've tried all kinds of things. We've tried sending out mailers and, the junk mail that you get in your mailbox. We've tried some of that stuff. We've tried networking is a huge thing. Referrals are the best of the best. You're not paying anyone to refer to you. So it's hard. I mean, we're doing things that are not cheap. This is an expensive field. It's an expensive field to do or to go into as a practitioner, actually. I don't think people realize that either, but it's also an expensive field to get anything done in. This isn't,
This is not covered by
like
insurance. So
not
every
covered by
time you're
insurance.
going, it's what, like, is it common to see
All
five
cash
hundred
pay.
dollars? Yeah,
At least.
okay.
So like a full face Botox treatment, or say you're just doing FDA approved areas, which is your frown, your forehead, and your crow's feet. FDA approved amount for that is 64 units. We charge $12.50 a unit, so you're at over $700 for that every 3 months.
I was gonna say for like 12 weeks, right?
Yep, 3 to 4 months is usually how long it lasts. So it's a very expensive field. You've got filler also $600, $700, $800, $900 a syringe. and a syringe doesn't cover very much area. So yeah, it's hard. I mean, you can also have financing options, payment plan options, some of those things can help, but it is an expensive, you know, place to come in and get something done. So
Yeah.
it's kind of hard to market whenever you're doing treatments that are on the pricier side.
Okay, so let's say that someone comes in and pays $600 for injections.
Mhm.
I'm assuming that you are not taking $600 worth of profit home. And I think that's important to note that like your cost is close to that.
Yeah. So, Botox is the most expensive neurotoxin. It was the OG neurotoxin, the very first one. And so it's the most expensive. They kind of like Allergan owns them. They kind of lead the way in aesthetics, but I'm sure they're expensive because they're putting in a lot of research and all of that, but it's a drug company, it's a pharmaceutical company. We all know that they like to make money. And so they keep raising their prices. And so that affects us as injectors, as small businesses. And
Mhm.
most of us are small businesses in this aesthetics industry. There are very few franchises in this industry.
Mhm.
And so I will say it's cost a bottle of Botox, which is 100 units. So maybe treats a patient and a half. Sometimes we're treating one patient with that, depending on if we're doing lower face neurotoxin, is over 600 and some dollars for a vial of Botox. That's what it costs us.
Wow.
So your profit on neurotoxin is super low. That's not usually, it's not where you're making your profit
Mm.
really is neurotoxin. Um, Sometimes there's more profit in filler or devices. So microneedling, lasers. Sometimes there's a little more profit in that if you get the machine paid off. But it's just a super expensive field to be in. Overhead in this field is so dang expensive. So
Mm.
expensive. And I think that people that are starting in this field too, nurses are like, hey, I'm just gonna go out and I'm gonna like do this as a side business. And that's when they have no idea. No one teaches us in nursing school or medical school how to run a business. No one teaches us business metrics. No one teaches us profit or KPIs or any of that. No one teaches any of that in the medical field. So people are out here like hardly making a profit,
Yeah.
running specials because they have
Yeah.
just to get clients in the door. It's and I try to very much, I was lucky to grow up in a small business entrepreneurship family. So I know that stuff. I've been around it. I have like heard the lingo since at the dinner table since I was little. But a lot of these people have no idea about any of that. And so as medical director, I do try to kind of go over and give them some, you know, information and some examples and guidance on marketing and profitability. It's just, yeah, it's an expensive venture, an expensive overhead. It's not it's not the place to go to make quick cash, I don't feel like.
That's a good point to make. Okay, so I want to transition to something fun really quickly. That's kind of off topic of work. What is something you're loving right now? Maybe a pop culture moment, a book that you've read that you would recommend, or a TV show you're loving, just something that the girls need to know.
Oh man. Um, let's see. I'm trying to think. I have definitely loved reading more lately. I felt like I went years without reading. And so I got a Kindle though for Christmas because I was like, I'm just buying all these books. I should just get a Kindle. So I've definitely tried to put my social media or my phone or turn the TV off more and just sit and read in the evenings. I don't know. My books are kind of all over the place. I'm not a person that really likes to read self-help books or anything like that. I think that's like a big I feel like a lot of people like that right now. They like the self-help like stuff, and I just
Journey, yeah,
can't get into it. I just can't. I want something that I sit down and read and like takes me away and just
turns your
have
brain
this.
off.
Yes. And
Yes.
so I don't know. I've got all kinds of, I go from like, I've read Colleen Hoover and all of those to like, oh, what's the name? Frida something, where it's like murder mystery, true crime stuff. So I feel like for me, I'm kind of in that.
And it's
But
nice when you have a Kindle because like some of those books, Colleen Hoover's and a lot of mysteries are
yeah.
free.
Yeah, and I do Kindle Unlimited, and so it's like $13 a month, but when I'm reading multiple books a month, it totally pays for itself.
Oh my gosh, you
Yeah.
just have to read more than one.
Yeah, exactly. So I
Yeah.
think that that's been like what I've been into lately. I did try sourdough. I did try
You
the
did.
sourdough train. Yes. It is still in my fridge because I just got tired of feeding it and all the things. I did okay. I mean, I made like a loaf or two. But I don't know. I'm so dang busy. I can't like, I'm just trying to keep kids alive. I can't
Yeah.
also keep bread alive half the time. So maybe I'll jump back in when I decide I have some more time. But I mean, it was kind of a fun thing to try. And, um, you know, my
Yeah.
sister was like amazing at it. And I'm over here like, I don't know, my loaf is okay. It's like dense, but it's fine. It's edible.
Is your sister-in-law close? Because if so, then I would just get it from her.
No, they moved
Oh,
to
shoot.
Texas, so she's not here. But if we get together and she brings it, we met in Dallas a couple weeks ago, and so she brought some. I'm like, yeah, yours definitely tastes
Way better.
mine. Definitely better than mine, but it's okay. We all have our things, and sourdough just
Yep.
might not be mine.
Yeah. I've never done it. My husband tried to make his own starter and it was
Yeah,
like a science fair in my kitchen for like 2 months.
yeah,
I'm like, can you
it is.
please give up? Like, I
I
just want to
know.
buy, I want to buy it on Facebook. I want you to be
Uh-huh.
done.
I know. And I was like, what was it? Probably a couple weeks ago. I went to Whole Foods and my husband's like, "Oh, so you got sourdough?" I'm like, "Yeah, I just decided I'll just buy it. It's fine. No,
It's way
I can
better
find
too.
it. It's okay. I'll buy it. It's fine."
Yeah.
Yeah.
Well, I'm on the same boat as you for that. I think, it takes a special type of trad wife and I'm not there
Yeah.
yet.
Yeah. I'm not a trad wife.
Yeah.
I don't think that's ever gonna be me.
Yeah.
So I don't know. I don't know if it's good or bad. I love the idea of it. I love the idea of like having my own eggs and sourdough and making all my food, but yeah,
You run a
working
business.
moms you can't do all of it.
Yeah.
Yeah.
That's true. Okay, well, that was fun. I also love to read and I like the idea of sourdough. So we can relate on that, but we
Yeah.
haven't necessarily succeeded.
Yeah, exactly.
Okay, so one last question I always like to ask is what is a piece of advice that you as a working girl slash working mom won't gatekeep?
Um, I would say definitely don't be afraid to try new things. I hopped into this industry literally knowing nothing. I felt very less than when I jumped in. I followed all these injectors on Instagram and watched them, and it looked amazing and they were just getting all these amazing outcomes and I'm sure had no complications and all those, it just looked great. But I think for me, just don't be afraid to change, to pivot, to look at something different, to find something else that fits your lifestyle better. You know, I didn't, I always wanted to be a working mom. I always wanted to have a career. I thought for sure, I'm always going to have a career. I tried the stay-at-home mom thing for a couple years and it was not my jam. I didn't love it. I like having my own thing. Feel like it gives me more of a sense of purpose and,
And
but
to bring
it's
in your
kind of
own
best of
money?
both worlds for me.
Yeah.
I get I get to be home with my kids. I work 3 days a week in office. I do trainings and medical director stuff on my other 2 days usually, but I don't I think it's okay to pivot, and I think it's okay for my medical field friends, I think it's okay to leave the medical field in a traditional sense. I think that some people think leaving and going to aesthetics is like almost like cheating, like, oh, you're just doing that. Like, it's not real. It's not real medical field. You're not saving lives. I'm not doing CPR, whatever. But I think that I know this is a totally like, this isn't exactly your question, but I think that too, this field can give you that sense of helping purpose that you went to school for. Um, I have people that have come in and, like you're transforming confidence. You are like making these women feel so good about themselves. And you don't know their story. They've had grief and loss and stress and are new moms and are trying new careers. Like these are obviously they're mostly women, but these women just want to feel confident about themselves. And I don't think that leaving traditional medicine to do something like this is cheating. I think that you can pivot, you can try something new and still feel a sense of purpose and like you're giving back and you're helping. It's just in a different sense. So I think that looking at other people and always thinking that they've got it figured out. I don't have it figured out. I think people would look at my Instagram and think, oh gosh, she's on it. She's got it figured out. Like she's doing all these things. She's a trainer. She's like, but I can go in and train the next person and feel like, or be around other people and feel less than. I don't think that no one has it figured out. Think it's okay to take risks and you're going to have to, succeed and move along in this world. I think that you have to take risks. And so yeah, I think it's okay to pivot. Even if it wasn't your long-term plan. This was never my plan. I'm very much a planner. And I think it's okay to try something new and put yourself out there and leave your original plan behind that you had.
Yeah, I love that you also said that this, like, you're still helping, because at the heart of a nurse, I really think that most people get into it because they love the rewarding feel of helping people. And
Yeah.
this industry and this career still allows you to really make a difference.
It does. But I don't think people don't think that a lot. And I think until you're in it, until you interact with these patients every day and you develop those relationships, I think that then you start to see that. Then you start to feel those rewards. But, you know, it's going to have its issues as with any other job or career, but it's a fun one. It's a less stressful. I'm
Yeah,
not working 12-hour shifts and I'm not running codes and I'm not, it's, I don't know. It's a whole different type of medical field. I love the mix of art and beauty and science that it all kind of, you know, comes together
yes.
and it's a fun mixture of everything for me.
Yeah. Well, this was really great to learn from you. And if other women are interested in pursuing this field,
Yeah.
what is a good way to get a hold of you? And also, what is your company called again so that they can come and get services done from you?
Yeah. So our office is called Vita Bella Medspa. We are located in the Arrowhead area, Glendale, Peoria area, West Valley of Arizona. And then my Instagram is the Arizona Injector. I have tons of information on treatments, so from patient perspective to injector perspective, I have tons of info on there. My website is on there, thearizonainjector.com. You can always email me, info@thearizonainjector.com. And so, you don't have to be from this state, from Arizona to train with me or take courses with me. you do have to, if you're not from Arizona, you have to have a license from a compact state to be able to inject here at the trainings, but that can kind of be worked through. So yeah, I love teaching, and I love, that this industry is growing, and there's definitely room for everyone. There's a ton of people in this world, and you may just be the perfect fit with the perfect aesthetic for someone and maybe not for other people. So it's a fun industry to, get into. And so, yeah, I'd love to chat if anyone's interested.
Cool. All right, guys, I'll have all of those links in the show notes as well. Well, thank you, Kelci, for joining. This was really a lot of fun and great to meet you.
Yeah, thanks so much for having me.
Have a great day.
You.
Welcome back to another episode of Working Girls Don't Gatekeep. Today we have Kelci Hunter here with us. She is an aesthetic nurse practitioner out of Phoenix, Arizona. She focuses on filler and Botox, collagen fillers, medical weight loss, and semaglutide as well. Looking forward to discussing with her what her journey has been like to end up here, not only in the nursing field, but also as an entrepreneur. Welcome, Kelci.